So with that, I'll hand it over to Dr. Barkemeyer. He's actually going to be one of your lecturers next year for your L1 classes. He's going to teach you about neonatology and how to take care of sick babies, to put it very bluntly. But he's a great guy, and he's going to give you a talk about special needs kids.
Thank you. I'm a little worried because I thought I'd change the date to today's date. It's something different show, so I don't know if it's going to show up here. But we'll get through it together. Each of y'all comes here with a story. And, you know, some of y'all came right through, some of y'all right out of college, some of y'all have done other things in life. You've done good things, bad things, tough times, easy times. And each kid at camp has a story too. And what I'm going to tell you now is an example of one child's story. That child's my own child. Dr. Lowell thought about being old. I remember when he came to med school, so I'm even older than that. And I have my 25-year reunion coming up. And when you go through med school and before I had kids, you don't know what your life's going to be like. And I'm blessed with 5 kids, and one of them has special needs. And this is her story and our story. And in telling you this, I want you to appreciate her story, just as each of your campers are special in their own way, to sort of recognize each person's individuality. So what special healthcare needs? Well, it means a lot of things, but the bottom line is the child needs a level of service above what a regular child might need. There'll be no testaments, by the way, in anything, but in real life there will be lots of tests. And it's pretty common. About 20% of households have a child with special needs. Somewhere in the teen percentages of kids are affected. And of these people who are affected, about a quarter of those kids are affected a fair amount of their life by their problem. So asthma could mean special needs. Sickle cell disease could mean special needs. Leukemia and having to go through chemo and recovery, that can be special needs. Seizure disorder, mental retardation, learning disability, autism, all those result in special needs children. So here's our story. I told you I had 5 kids. We had 3 healthy, beautiful daughters. And in February of 1998, the 4th daughter was born after a normal pregnancy. Her name is Anna. And we were not expecting any problem from Anna. But our life changed when she came into it, much different than it changed with any of the other children. Anna was what we called a good baby. She was too good. She was very passive. She wasn't very active. She didn't demand to be fed. She didn't cry. She slept through the night. Too good sometimes isn't really good for the baby. And so after, she was in the hospital for a very short time after birth. We didn't think anything terrible. We thought that we were hopeful things would get better. But it didn't happen. And by about a month of age and follow-up visits to the pediatrician and to the neurologist, we started to uncover some things. And Anna had a problem which we still don't have a diagnosis for. And that may be the case for your camper too. Sometimes they have some symptoms but don't have a reason why. And so that's not so important, but it's sort of the journey is probably more important than the end point. But whenever any of the parents or parents of your kids with special needs face this, the parents react a lot of different ways. Shock, depression, guilt, anger, sadness, anxiety, lots of things, what to expect. Kind of the same thing you might do on your first day at grocery management. And I'm not sure what to get into it. I learned this back in the summer of 1983, when I first came to med school, summer and fall of '83. Elizabeth Kubler-Ross put forth on death and dying. When you're faced with death, people go through stages: denial and isolation, anger, bargaining, depression, acceptance. This is not about death in this setting, but it's about death with a special needs child. It's the death of the normal child. The hopes and dreams for that child are replaced with new hopes and dreams. So the normal child dies, and the changes before you get to acceptance. So that's what goes on, and so you have to replace them with new hopes and new dreams. And I think the Camp Tiger experience is part of that. It's a great thing. It's a great thing to have. It's good for the kids. It's probably better for you guys to see they have this opportunity. So Anna goes through infancy, and she's not like other kids. She doesn't roll over like other kids. She doesn't sit up like other kids. She needs help. By this time, we've looked from February to December by the Christmas tree. She's being propped up here by one of the therapists who come to the house as part of a program called the Early Intervention Program, and still in existence. And her sisters are looking around and realizing maybe things are a little bit different. She's a year of age, and kids that year of age are supposed to be walking, sitting up pretty easily. Instead, she's kind of propped up. She seems happy, she's smiling, but we knew that she wasn't like, in infancy, in pediatrics, it's called failure to thrive and developmental delay. And when you fail to thrive and when you developmental delay, when you fall behind by a month or 2 of your milestones, it doesn't mean you'll be a month or 2 behind your milestones when you're older. But as the milestones get more significant, you fall further and further behind, but you don't know where things are going to end up. Anna always used to turn off lots of, this is, what Dr. Lowe was saying, every kid's a little different. Anna was pleasant when nobody was around, but when you bring a lot of crowd around, noise, special events, she'd turn it off, she'd zone out. This is her first birthday, and we bring, family members over. 1-year-olds don't have friends, so it's always the parents' friends, you know that if you're a parent. And so the parents' friends are there, you're trying to show that Anna's doing better, so you watch her now since she's fallen asleep. And then, of course, people leave when she wakes up. But that's pretty typical for her behavior. She's 13 months, and I was working at Children's Hospital, as I do still, and I get a call from my wife that Anna was turning blue and not looking right, and I rushed her and we brought her to the hospital. Bottom line, she had aspiration pneumonia, and it was sort of a symptom of a poor feeding and trouble swallowing that she experienced. She went through some different testing while she was there for reflux and for breathing and stuff, and it's the first time I'm seeing my own child strapped to all these types of things. She was in the ICU for one night, but got better and was able to. Shortly after she went home, we had to plan a trip. This was in the early spring of her being a year of age. We were going skiing, and we had everything ready. We had all tickets bought, the older kids were looking forward to it, and Anna now was just out of the hospital for pneumonia. Of course, breathing problem, going skiing at altitude, we didn't think Anna could ski. No, we didn't think that, we weren't sure how safe it was going to be to her to go to altitude this setting. But I'm different than most of the parents of the kids at Camp Tiger. I have some knowledge, some resources. I scrounged up a pulse oximeter from a person at Children's Hospital. I called ahead to the place where we're living and got some oxygen, and we went skiing. And we made a decision as a family that we were gonna do things with our family and include Anna in them. And she was part of the family. If it meant doing a little bit something extra, we'd manage. So obviously, the picture tells the story. She's there, she's in the snow, she got a little bit of extra oxygen at altitude, and she did fine. The only thing we didn't have a tire or a vehicle with snow tires, so it was about to snow, and the oxygen, the cylinders we had were running low, and I didn't want to get caught there without way to get out of there. So we left the day early before it snowed. So some practical stuff to do, but we enjoyed it, and it sort of set the tone for how we were going to approach things. About a month later, we came back, and unrelated to the ski trip or anything else, she started having seizures. First time we noticed seizures, this is her in the midst of a seizure. When your child has a seizure, what do? You grab the camera and take a picture, right? No, this was one of many seizures she went through. And so I do have, this is a picture of her. The specific type of seizure Anna has is called infantile spasms. And it bores a more ominous prognosis for neurologic development. And if my mindset and my heart had not been deflated before now, this really kind of like took away more hope for her being normal, because these kids have a poor neurologic outcome, and we knew things with Anna were not going to be right. She got an EEG, she got these injections because this odd type of seizure was treated with injections of ACTH. Unfortunately, the ACTH did not work, and so we tried something else. We tried a drug at the time that was pretty new called vigabatrin, and the vigabatrin didn't work either, and this is now months have elapsed, and we're at the beach, and we're taking her off the vigabatrin at the neurologist's direction, and as she's coming down from the vigabatrin, she's wired. She didn't sleep but about maybe 2 or 3 hours the whole weekend at the beach. So this is in the middle of the night, my wife and I and Anna on the beach, taking her out of the little rental condo we were in, so that she's not waking up the rest of the family. But these are the kinds of some things we went into. And eventually she got put on some medicines that control the seizures better. She has still on the same medicines to this day, and she's doing fine with it. And over time now, Anna's getting older, and the kids are seeing her in a little bit different light from how things are. By January of 2000, Anna's almost 2, and she has a little millennium brother born into the family. And this was interesting because most people look at kids, and as you look at your campers, the kids who have some type of developmental problem, sometimes you look at them based on their developmental age. And so you look at a child who's not doing so much and think they're very young. In this case here, as Michael's an infant and Anna is still functioning as an infant, she's twice the size of him, but he gradually passed her up in neurodevelopmental milestones. So my wife would be taken through the mall or double stroller, and Anna's much bigger, but she's kind of sitting there, and Michael's kind of small but sitting there, and they look doing the same thing. And so nice and well-intentioned ladies would say, "Hey, are they twins?" And my wife's like, "No, they're not twins. She's 3 times the size," and stuff like that. But it's okay. That's not what I'm trying to do. So, but people of well-intentioned, and I think with your campers, you're going to see sometimes odd behaviors. You're going to see things you're not used to seeing, and just take it in stride. We always have kids come up to us to this day. They kind of look at Anna and stare at her and want to know what's going on. You just try as best you can to explain that, and most of your families will be pretty aware of that. So Anna turns 2. And she goes from the home care setting for the therapist to the developmental center, which used to be called a dental school. It was our first exposure of her to other kids with special needs in the classroom setting. And she's doing fine. She likes to put stuff in her mouth, but she still wasn't growing quite so well. So one time I had the bright idea of mixing some peanut butter into her feeds, because the peanut butter would help give her more calories and good protein. And of course, she's peanut allergic, which we found out. So this is what you're seeing here. Talk about a little bit of mild anaphylaxis. A few years later, it happened again, because my son was having a peanut butter and jelly sandwich outside in the backyard. She was laying on a blanket. She got her foot into his plate, got peanut butter on the foot, to the mouth, to the, there you see it. So anyway, peanut allergy. Not so much allergic to crawfish and beer. But she didn't have a lot of feeding problems. And in Anna's case, she had something called G reflux, tendency to spit up her feeds, which resulted in poor hydration. And kids like Anna who are delayed and have what's called hypotonia, or poor muscle tone, they get constipation, they can't strain and push it hard enough out. When you strain, instead of passing a stool, they pass, they spit up. And so the cycle kind of kept going. So by the time she's turning 3 here, she's not so happy, because it's not fun to be 3 and constipated and not the best hydrated. So she had an operation done shortly thereafter called a Nissen fundoplication and a gastrostomy tube, and this is actual still shot from her laparoscopic surgery. They kind of tightened up the stomach junction near the esophagus. And here's my wife, who's non-medical. She's a CPA by trade and a mom by profession. Here's her learning how to give this feeding tube to Anna, which we would still use to this day for liquids, but we give her solids by mouth. She's on a parade diet. So some of your campers might occasionally have some special dietary needs you'll also have to be aware of. When you turn 3, you leave the school system, you leave the home system and go into the school system for your education as well as for your special needs therapies. And that's what this public law that's in place to allow kids with special needs to get the needs they have in school says. And there's a few terms that sort of mimic what's going to happen in Camp Tiger. You're trying to allow these kids to have what's called a least restrictive environment, allowing them to thrive, to get around and to function like other kids function. Normalization is trying to make that child's life as much as like the non-disabled child's life. So if regular kids can have a summer camp, why can't kids with special needs? And that's kind of the meaning behind Camp Tiger. And mainstreaming, mixing together normal kids and kids with special needs together so they can learn from each other. So when you go to school, you can't be in a stroller anymore. You have to be in a wheelchair. And this is just a picture of another vacation of Anna in Washington, D.C. That's FDR, his wheelchair. And when he was president in the Depression and World War II especially, there was a need to show that he was a strong person. So they never showed his disability. In fact, they kind of concealed his disability. They made his wheelchair look like a regular chair. They'd wheel him up to the podium. He would kind of stand up and be propped up on the podium and start his talk. And then they would start the cameras rolling. And that's what they broadcast. So at the time, disabilities were not embraced. They were kind of concealed. And that's obviously changed nowadays in many settings. And so we had to get a wheelchair for Anna. So what do those wheelchairs cost? Right here, $5,666, and all patient responsibility. Anna didn't even have a job, so she wanted us to pay for this. We're like, no way. No, so this is another point to make. We have insurance. We have good insurance. Except, like anybody else, the insurance company wants to jump through hoops. So we have to go back and forth with the insurance company to get them to pay. And imagine it's bad enough having a child with special needs, but having to fight the insurance company. And eventually, they paid their share. And at this point, we got them negotiated somewhere up in here where we were supposed to pay $3,000. We got that even better. And anyway, the wheelchairs did pretty well. And she actually is now on her second wheelchair, but they lasted a good long time. So here's Anna in her wheelchair. And now we have a child who's got a, delayed development, has a feeding tube, had an operation, can't be fed like other kids, and is in a wheelchair. It really starts to get home as a parent, but your child is not like other kids, and is not going to be like other kids. Speaking about not being like other kids, all my other kids, we raised in New Orleans, and they've gone to Catholic school, and there's no Catholic school for kids with adult needs, and so we were going to have to go to all these parish public school system, which doesn't always have the best reputation, and especially pre-Katrina. And for us, it was eye-opening. We had a lot of different things we could have done, and we chose to put her in the public school that she was assigned to and see how it would go. It just so happens we had some wonderful people there who cared for Anna and were very loving to her. It also just so happens that Anna was the only white child in her school. And so I'd walk into the office and they'd say, "You must be Anna's dad." How'd you know? So it's different, just to see that. And so you got to see lots of different great things that probably would have been shielded for my whole life. And this setting here. My other kids have been Christmas angels in their programs at the Catholic schools, and my wife actually, Anna, could be a Christmas angel in the school program, and they said yes, she could, and oh, by the way, can you make some costumes for our classmates? So Anna was amongst a bunch of angels in the Christmas program. Anna turns 4. You're much happier when you're not constipated and you have a feeding tube and you're hydrated when your 4th birthday compared to your 3rd birthday. The family's growing up. Here's another ski trip that we're moving along here. We're not on oxygen anymore. We don't have any pulse oximeter. And this is something with kids. You know, you remember you're in school, and you're going to do this in med school. In your first year, for the new first years, you're going to write how I spent my summer. They're going to post it on the wall, and you can read it. But it says here, this is my daughter who was 9 at the time. She's now a freshman at LSU in Baton Rouge. She says, this year in school, I like to learn math. I feel good when I do something good. I'm happiest when I'm with my friends because they are fun. If I had one wish, I would heal my sister who has brain damage. Thank you for reading. Bye. As a parent, to hear your child wish for her sister to be healed. Everybody else is asking for, you know, cell phones and the latest Nintendo, and your daughter's asking, who's 9, is asking for her sister with brain damage to be healed. It obviously takes your heart away. And so siblings play an important role. And so here we have by the Old Navy clock on the shirt here, 2003 is here, and Elisa's the oldest. She's now graduated from LSU, and she sees Anna now as she's a teenager. She sees Anna as a child who is not like other kids. And Michael sees Anna in a different way because he's much younger. This is part of her childhood development, how they view things. And so the siblings have a great role in these kids. My kids have been great with Anna. They do things with us to help us out. And in this setting here, you know, kids do well, but you have problems when you expect them to do more, to assume maturity and responsibility beyond their years. So if you kind of give it to them in doses and not always rely on them, they handle it pretty well. It takes a lot to care for kids with special needs. Some kids, if they just need to take a medicine once or twice a day, not so much. But for some kids like Anna, when you're talking about having to bathe her and carry her to the car and get a wheelchair off the car and put her back in the wheelchair, put the wheelchair back in the car, bathe her, give her medicines, crush her medicines, feeding tube, change diapers, etc. A lot more times involved. And so, just to show, Anna now weighs about 70 pounds. And so, I'm not as young as I used to be, nor is my wife, but we manage because we've kind of grown our muscles with her, so we can tote around the 70-pound little girl, big girl, and get away with it. Anna's been in other places. Here she is outside of the Iwo Jima Memorial. And here's on a trip here. And if you notice most of the pictures, the other kids are looking at the camera and Anna's looking off. So I put this picture here because in this case here, the other kids are looking at TV in the car. And Anna happened to be looking at the camera for once. So Anna likes the holidays, and Anna likes Mardi Gras. By the way, you have a child, we let you at a parade, what do people in the floats do? They want to throw it to her, okay? Anna, she can't catch, you know, she can't defend herself. So we learned pretty quickly, you don't put her out in visible spots at parades, you put her behind the tree, behind the people, so that she's not being thrown at by lots of bees by well-intentioned drunk people on floats. So I think that this is good for the child. Here she is as Minnie Mouse. Here she is in a sort of South Louisiana pumpkin patch, if you will. Wheelchairs don't do so well in pumpkin patches. Here she is outside the arch, in the arch, the Gateway Arch in St. Louis. Again, she's the one not looking at the camera. And she turns a little bit older each year. In a lot of the pictures, you see this guy, and this is my dad, who is, his birthday is around the same time as Anna, so they oftentimes celebrate their birthday. In our case, my dad and my wife's parents have been great treasures to us in caring for Anna, and lots of the people you deal with have great family support also. So the years keep going by. Anna is 6. She goes to a special field day for the campers and stuff, and in her own way, just like a Camp Tiger, these kids enjoy it. And here she is having fun in the bottle squeeze and in the ball punch, and just having her own good old time here. So these kids have fun in their own different ways, and at the end of the day, like anyone else, she's worn out and tired. She loves water. She doesn't know that she can't swim, so you got to keep her away from it as best you can. She always wants to dive in. Here, I want to take a picture of Spanish Plaza with the fountain in the background, but Anna keeps turning around to lunge for the water. So what do? You just tell all the other kids, you lunge for the water, and snap the picture from the other side. So you make adjustments in life to these situations. I mentioned before about parades and the danger there. There are other things. She's got a very weak gag reflex, so she likes to put stuff in her mouth, and it really doesn't really bother her. She can't cough and choke to get it out. So unfortunately, that's a protective mechanism that she lacks. And so sometimes if she finds a bit of paper, in this case here, a bit of a newsprint from a mail, to throw away mail thing, crumbles it up, puts it in her mouth without us realizing it, just because she wants to chew on it. It's not until literally the next day, when she's not eating breakfast, that we realize that she's got something in the throat. And so we fish it out, and this is what it is. It's kind of formed a perfect cast to the back of the throat. And that's a potential danger. These kids can get into different types of trouble without realizing it because of the situations. She's a little bit more, we try to keep her area protected, but she's got enough mobility, as you see, to get around and reach and get stuff that she wants to get to. So injury prevention for these kids is something that's significant. And as Dr. Longwell said, you have to be aware of them, you have to look out for them. So don't get caught up in a situation where you may lead them to injury, against their will and your better judgment perhaps. So just be aware of that depending on the situation. I'm going to read this because it says something about how these people sometimes face these problems. This is something called Where Are the Parents? I don't know who wrote it, but it just kind of tells you where these kids' families are coming from sometimes. They're on the phone with doctors and hospitals and fighting with insurance companies, waiting through the red tape in order that their child's medical needs can be properly addressed. They're buried under a mountain of paperwork and medical bills, trying to make sense of a system that seems designed to confuse and intimidate, all but the very savvy. Where are the parents? They're at home diapering their 15-year-old son or trying to lift their 100-pound daughter onto the toilet. They're spending an hour at each meal to feed a child who cannot chew, while laboriously and carefully feeding a child through a G-tube. They're administering medications, changing catheters, and switching oxygen tanks. Where are the parents? Bleary-eyed and exhausted in hospital emergency rooms, waiting for the test results to come back and wondering, is this the time when my child doesn't pull through? They are sitting patiently in hospital rooms as their child recovers from yet another surgery to lengthen hamstrings or straighten backs or repair a faulty internal organ. They're waiting in long lines in county clinics because no insurance company will touch their child. Where are the parents? They're sleeping in shifts because their child won't sleep more than 2 or 3 hours a night and must constantly be watched lest he do himself or another member of the family harm. They're sitting at home with their child because family and friends are either too intimidated or too unwilling to help with child care, and the state agencies that are designed to help are suffering cutbacks of their own. Where are the parents? So the kids you're dealing with may be coming from some of these backgrounds, and so you're providing a great respite care to the family, doing a great service, plus helping the child also. So we're going to keep moving here because Anna's still got a ways to go. She's 7. She goes to Alaska with her family. She comes back. She goes to a new school, new environment. We talked about transition to change. It's sometimes difficult change for the family. Speaking of change, this little flood thing happened in the summer, and it floods your house and gets a little water in your house and ruins a few things, including your kids' toys and an old piano. And you pick your roots up and you get your feeling back on because you've had a child with special needs and you're pretty resilient and you can deal with almost anything that comes your way, hopefully. And life keeps going on. There's Anna and her grandpa again, and Anna with her family turning older and older, and happy in her own little way in her new house post-Katrina while the old house is getting fixed. And she turns 11, and she likes to put stuff in her mouth. I'll tell you about stuff like the newsprint. She loves to put these bibs in her mouth because it just soothes her some sort of way. It's kind of almost like serves as a trap for her drool. And she likes to put her left hand in her mouth. So that little brace in her left arm now is there to stop her from chewing off her left hand, which she wants to always gnaw. Not chewing it off, but just making it pretty raw. She gets bigger and she's finally in a big girl bed, and we're back in the house, and life keeps moving along here. She turns 12, and her papa turns much older than that. And so last year she turns 13. What do teenagers want? They want to be with their friends, their peer group, so she has a party with the Dominican class of 2011. They come over and they pin the bib on Anna. A little bib thing on the table there, you see their kind of little thing like that, their own little version. It's great to see these kids kind of, again, like you were doing, looking out for kids with special needs. Our little angel is getting older and older, looking ahead. Her life, goes on, and so does ours, and who cares for her in the future? These are things that we think of and your families will think of. Practical aspects of housing, of handling and bathing, and diapering these kids, and transportation as she gets older and gets bigger, and we get older and weaker. Aging. And long-term care, what's going to be out there. But you can't worry about the stuff that's happening too far in the distance. You worry about today. You can't worry about third-year med school. You can't worry about second-year med school. You got to get into the first day and study. And the same with your Camp Tiger experience. Each day, make it a fun event for you and a good event for your camper. And certainly the cost of part of this. So it's a blessing to have children. It's a blessing to have a child like Anna. These are things that I can kind of look back and things I learned from Anna, and I hope you can start to learn these from some of the experiences you have. I learned to be patient, more patient from her, to be more accepting, to be more understanding, to be appreciative of the gifts around me, to be more humane in the patients I care for. I deal with sick babies who sometimes have bad outcomes, and trying to help their parents deal with that. I think I've become much more compassionate in that, more sympathetic. I also have credibility. G2, I know about it. I've been dealing with it for 11 11 years now. I can talk to a parent about what it means for the child and what it means for the parents and have that instant G2 bread. Practical stuff I learned, and also facilitated for families to come and talk. I've had families come talk in this room to some of our different interest groups, and it just helps them to deal with what they're dealing with. So we've come a long way from February of 1998, and if we put some time, as time goes by here, the family kind of continues to grow. And now the little guy who was once in the stroller next to him is now pulling her along and leading the way. And he's helping her at her school's field day, helping her putt. And here's some of her classmates. This little guy with Down syndrome might represent a typical camper. Brady, he's a good kid, great kid, but every now and then he pulls down his hair. And she can't fight back. And so when you talk about the little restraint thing and stuff that's necessary, sometimes you just gotta remove the kid from the situation and they can do better. But that's just a little small example. There's JD in the background and Nicole over here. Here's Brady, not pulling the hair but helping her out. So sometimes, you know, you get the good and the bad of all this. In 14 years, we've had 2 wheelchairs. We've had 4 mini food processors chopping up her food to feed her. Over 12,000 tube feedings. Over 30,000 diaper changes. It's a lot of hand washing. And over 2.3 million milligrams of Chegnital, okay, for her seizures. And it sounds like a lot, but it's about 5 pounds. But the milligrams can make things look really big. And we've had a few tears, but we've had a great experience. And we've had many more smiles than anything else, because the joy we see in what Anna does is a different type of joy than seeing a child get an A on a test or do well in a sporting event. But we appreciate her for who she is, and we're blessed to have her. She maybe don't think as much as some of our other kids. Here she is at the zoo with her battle, and this monkey's pondering the situation in the background there, and her thinking in her own little ways. I often wonder what goes through her mind and stuff, because I think she sees the world in a different way, and she certainly can't express it, but she does realize her role in the world, and it's just hard for us to sort of understand that. So in closing, I just wanted to give you this little spiel here about dealing with special needs kids and about special needs parents. And this is written by somebody called Emily Pearl Kingsley. And she was a writer for Sesame Street, so she knew how to write, and she knew about kids because one of her kids had Down syndrome. And she wrote this called Welcome to Holland. She writes, I'm often asked to describe the experience of raising a child with a disability, to try to help people who have not shared that unique experience to understand it, to imagine how it will feel. It's like this. When you're going to have a baby, it's like planning a fabulous vacation trip to Italy. You buy a bunch of guidebooks and make your wonderful plans. The Colosseum, the Michelangelo David, the gondolas in Venice. You may learn some handy phrases in Italian. It's all very exciting. After months of eager anticipation, the day finally arrives. You pack your bags and off you go. Several hours later, the plane lands. The stewardess comes in and says, "Welcome to Holland." Holland, you say? What do you mean Holland? I signed up for Italy. I'm supposed to be in Italy? All my life I've dreamed of going to Italy, but there's been a change in the flight plan. They've landed in Holland, and there you must stay. The important thing is that they haven't taken you to a horrible, disgusting, filthy place full of pestilence, famine, and disease. It's just a different place. So you must go out and buy new guidebooks, and you must learn a whole new language, and you will meet a whole new group of people you never would have met. It's just a different place. It's slower paced than Italy, less flashy than Italy, but after you've been there for a while and you catch your breath, you look around and you begin to notice that Holland has windmills and Holland has tulips. Holland even has Rembrandts. But everyone you know is busy coming and going from Italy, and they're all bragging about what a wonderful time they had there. And for the rest of your life, you'll say, yes, that's where I was supposed to go. That's what I had planned. And the pain of that will never, ever, ever, ever go away, because the loss of that dream is a very, very significant loss. But if you spend your life mourning the fact that you didn't get to Italy, you may never be free to enjoy the very special, very lovely things about Holland. So I certainly appreciate your attention, and I appreciate what you're going to be doing for the kids you have. I wish you well in med school. It's a great opportunity to help other people. It may come in your family, in your own family, you have an opportunity to raise children. Certainly, what you're going to have here in the next few weeks is going to be life-changing for you. Both the Camp Tiger interaction, your adjustment to med school. It's a lot to go through, but I think you're all ready, and I hope you have a good time. Thank you.